It is my pleasure to introduce our speaker for today. Our speaker is a Harvard trained plastic and reconstructive surgeon who is also the medical director of Advanced Plastic Surgery Institute in Reno, Tahoe, Nevada. He has been called upon as a key investigator for an array of funded grants from Allergan, Galderma, InMode, and MTF Biologics, which are among the most innovative healthcare companies at the forefront of aesthetic science. He is an active educator, key opinion leader, and lecturer, and in over the past 10 years, he has published and presented his work on over 150 occasions, not only in the US, but also in China, Taiwan, the Middle East, Europe, and South America. He is the author of six noteworthy books on special topics in aesthetics and reconstructive surgery. Let us all welcome Dr. Erez Dayan.
Thank you very much for the kind introduction. It's a pleasure and honor to be speaking with everyone. I'm very excited to tell you about some of this technology that we've really benefited from here in the United States, and looking forward to sharing some of our experience. I was very fortunate to be involved in this technology early on. We were one of the few sites in the United States who started the trials on this device some time ago. So I can really give you, I think, a good perspective on our experience with it. I'm going to go ahead and share my screen now. Okay, great. So here's our lecture. So really what we're talking about is hands-free body contouring. Hands-free meaning, you don't have a person who's required to use the device actively during the treatment. So when you look at body contouring as a whole, I think it's useful to look at what the current technology is in non-invasive body contouring. So we have here in the United States and really internationally, the options include radio frequency, include electrical muscle stimulation, cryolipolysis, which we're all familiar with as cool sculpting, and then there's also some laser devices and high frequency ultrasound devices. Really, this market has expanded very rapidly. If you look at the overall non-invasive body contouring market, there's 31 devices here in the United States that have received FDA approval just over 6 years, from 2012 to 2018. And the largest number of these devices entered the market in 2016. So 10 new devices entered in 2016. And the indications are rapidly expanding, and the patient's desire for these devices matches the demonstration of the increase in devices in the market. So if you look at the indications of use, there's a number of them, and they're increasing. So temporary reduction of cellulite, muscle aches and spasms, and skin tightening, and other applications. As far as the safety of these devices, they're actually quite safe with very few adverse events. So the issue with non-invasive body contouring is there are many unknowns. When I was doing my training at the Harvard program, part of my training was taught by Dr. Rox Anderson, who many of you may know. He was the inventor of cool sculpting and cryolipolysis back when it was a Zeltique product. And I think at the time, there were not many other options in non-invasive body contouring. So it was essentially the best option because there were not many other alternatives. And I think he would tell you right now that the landscape has changed dramatically. I don't know how familiar you guys are with cool sculpting. I'm sure you're very familiar with it. But I think, at least in the United States, cool sculpting is kind of the most known non-invasive body contouring device. However, I think so many people have done it that the results are very predictable, and they're relatively mild for the most part. Most patients tend to be underwhelmed. But the bigger issue really is that we have many ways of reducing fat. The problem is really skin contraction and skin tightening. And even Rox Anderson, who invented cool sculpting, would always say the holy grail of aesthetics is skin tightening in a non-invasive fashion. But there are a number of unknowns. Are we using cooling? Are we using heat? What is the value of muscle hypertrophy and muscle stimulation? So there are many questions that remain in this large market. And the other thing is, most device companies treat patients in a very singular, very unilateral fashion. So they treat all the patients like you see here on the right side of the slide. But really, our patients come in all different shapes and sizes and have different needs and different desires. So if you really look at the aesthetic patient as almost a pizza pie, we have skin, which can be cheese, the fat layer, which is tomato sauce, and then the muscle layer, which is bread. And these three components of the soft tissue envelope are essentially what we're talking about. We're talking about skin, fat, and muscle. In my field, these are the three areas we're impacting. And if we can impact each one of these in a very customizable and efficacious fashion, it really allows us to treat a wide variety of patients. So as a young plastic surgeon, when coming into practice, you feel like you're going into the dark ocean. I know that as a young plastic surgeon, having technology is really critical because patients are looking for the latest technology that works. They desire non-invasive body contouring. So it's very important for someone like myself in my practice to offer the spectrum of treatment modalities. And the problem is, these devices do come with an expense. And as a plastic surgeon, you want to make sure that you're investing your money properly in devices that are going to work. So, in our world, these are some of the different devices that are available. And I just want to briefly discuss some of them to give you some of my perspective on how I chose to use Evolve. So the problem becomes, if you have one device that performs one singular treatment, that's your hammer. And every patient that comes in, you try to apply this technology to, but it may not be the best technology for that patient. So if you look at cool sculpting, for example, if you have a patient that comes in desiring non-invasive body contouring, and they have a little bit of skin laxity, let's say they're a 40-year-old patient with 2 children, so they have some skin laxity, you may try to use your cool sculpting device. And what you may find is that it may reduce a little bit of the fat, but it will do nothing for the skin contraction. And in fact, it may make the patient worse because when you lose volume, your skin laxity appears more significant. So that may get you into some issues in terms of unhappy patients. Now, if you have a muscle stimulation device, for example, mSculpt, you may experience some muscle hypertrophy, but again, it won't do anything for skin contraction, and it'll do very little for fat remodeling or fat loss. So it limits you because each of these is addressing one area of the pizza pie. So if we could think of, if we can just dream of what the ideal device may be, this is the list that I made. So for me, it would be a hands-free device. And frankly, this has become much more relevant actually during COVID because patients and practitioners don't want to be in close contact. So having this device, being able to set it and being able to leave the room has actually had a huge value and has an even larger value now that COVID has become an issue. So this is a device where we can apply it to the patient, feel safe about walking away. We know that the device, and I'll show you some of our data, has been efficacious and valued by the patient. So if a patient is paying $1,000 or $2,000 per treatment, they need to feel value. And I welcome you to look at our reviews on Google or online. We have 5-star reviews, and I think a big part of that is making sure that patients feel value, making sure that when they leave this practice, they are happy with their treatment, happy with their result, and feel good about what they paid for it. And then the other thing that would be ideal would be a device that does multiple things, that can treat skin, muscle, and fat. Because our patients come in, just today, I had a patient who's a very fit Brazilian jiu-jitsu instructor, and she doesn't have much fat, but she does have some skin laxity, and she desires to hypertrophy the muscle layers. So we can customize her treatment. Another thing that would be ideal is synergistic mechanisms. So using 2 different modalities, for example, electrical muscle stimulation with radio frequency, that work together to overall give a better result than if each of them was done individually. And then either a low disposable cost or no disposable cost. I think for me, I don't like disposables because it limits how many treatments I can give. it affects ordering, and it's just another expense that preferably I would avoid. So if you look at the hands-free devices and body contouring, basically, this is a paper by Dr. Chilukuri, who's a well-known dermatologist here. There's different energy sources. So there's lasers, there's radio frequency, and there's cryolipolysis or cooling. And the problem is there are basically limitations to each of those technologies. And I'm going to kind of go through them and demonstrate what each of them are. So if you look at the muscle stimulation, it hypertrophies muscle. There may be some fat reduction, but it does nothing for skin laxity, which is probably the most important thing for patients. If you look at cryolipolysis, cryolipolysis is interesting because the studies are a little bit optimistic, I think. A lot of the studies talk about a 20 to 30% fat reduction by looking at ultrasound. And frankly, ultrasound is probably one of the worst modalities to look at this because it's very user dependent and it's very easily manipulated. But more than that, the treatment efficacy with cryolipolysis diminishes basically by half every time you repeat a treatment. So it's a bad situation sometimes when you have a patient and you apply a non-invasive body contouring technology and let's say they're not satisfied with their results, so you offer another treatment and another treatment. Those are not additive, meaning every additional treatment is only half as effective as the prior treatment. So the more you do, the less likely you are to make that patient happy. And there are significant disposable costs. So it really does nothing for muscle. It may reduce fat, and it does nothing for skin. Another thing that we actually have experienced, and I don't perform cryolipolysis in my office, but I do correct paradoxical adipose hyperplasia, which is a major issue, and as many investigators have identified, is seriously underreported. It's not clear what the mechanism is. We know that this fat is unique. It's hypocellular and hypovascular, but it's a problem. And here you can see in this photo, exactly where the applicator was applied. Instead of getting fat reduction, which was the intention, there was actually fat growth and fat hypertrophy. Sculpture I'm not going to talk about because it's a device that doesn't work and it's painful. And as a matter of fact, in the United States, there's a class action lawsuit regarding false claims and how it doesn't work. So back to the aesthetic patients. So skin, fat, and muscle. Now, InMode is one of the leading is probably the leading radio frequency company internationally. And here's the reason why. They are able to reach temperatures. It's really temperature control. The key to the InMode's, in my opinion, InMode's success is the ability to deliver the treatments in a very controlled and precise fashion. So just like the game of bocce ball that you see here, radio frequency works as long as you can control the temperature and reach exactly the point that you want to get to without exceeding it. So why is this important? Because there's a very interesting correlation. This is called an Arrhenius equation. So the line here, the white curve, demonstrates skin soft tissue contraction. And basically, there are multiple ways. This is not just temperature. There's a time-temperature relationship. So you can either treat at a very high temperature for a short period of time and obtain a similar soft tissue contraction to treating at a lower temperature for a longer period of time. And it's actually been shown in numerous animal and human studies that having lower temperatures for a longer period of time is more effective for collagen stimulation than higher temperatures for shorter periods of time. So we actually use a number of different radio frequency technologies from InMode. One of them is called the Body Tight or Face Tight. And this is a minimally invasive device that reaches a higher temperature. So we're talking about 68 degrees, 65, 68 degrees Celsius internally for a relative shorter period of time compared to the Evolve device, which is treating at a lower temperature, somewhere 42, 43 degrees Celsius for a longer period of time. And ironically, what we've been seeing is typically you expect the non-invasive to have less of a result than the minimally invasive. But what we've been finding is that treating at a slightly lower temperature for a longer duration is giving us very nice, nearly equivalent results, I would say, in many of these cases. So radio frequency is actually a very familiar technology. It's been used in different fields of medicine for almost 100 years. We use it in surgery every day, monopolar radio frequency, and the in-mode technology is bipolar radio frequency, which is by far more precise and more predictable. So what it is essentially an electromagnetic current that travels through tissue. And different types of tissue have different resistance or impedance. And so the tissues with more resistance preferentially generate more heat, and that heat is ultimately what causes soft tissue contraction. So this is a law of physics called Ohm's law. So collagen, fat have more resistance, and because of this resistance, they preferentially generate more heat. So these are the minimally invasive technologies we use, and basically they work by cleaving hydrogen bonds, denaturing collagen, so there's some immediate soft tissue contraction, but really the long-term effect of radio frequency is the initiation of an inflammatory and proliferative cascade. And what this does is, it's been shown, and we've done biopsy demonstrations as well as animal studies many times in the past, consistently shown to increase neocollagenesis, so more collagen formation, more elastin reorganization, as well as angiogenesis and lymphangiogenesis. So that's the benefits of radio frequency. So what is synergy? So synergy is when you take $1 plus $1, and when you add it, it's not $2, it's many dollars. And the reason we talk about synergy is because this is the first device to combine radio frequency and electrical muscle stimulation in a synergistic fashion. So the aesthetic patient has many different needs, and we have different types of patients. We have thin patients, kind of medium, average sized patients, and heavier patients. And essentially the goal is to be able to treat each one of these patients. And we need to figure out what matters more. Is it the fat layer? Is it the muscle layer? And what matters more to that particular patient? Because everybody has unique needs. So this device is particularly valuable to us because if I have a patient that is more concerned about fat or skin laxity, I can preferentially treat that patient. If I have a very thin patient that wants to stimulate their rectus muscle, maybe improve their core strength and reduce some of the diastasis of the rectus after having children, we can focus more on muscle stimulation, all on a singular platform with no disposables. So there's a lot of distinct advantages to us. So what is electrical muscle stimulation? So essentially an electrical muscle stimulation provides a supramaximal muscle contraction that you couldn't achieve voluntarily. And this device, I can tell you, I have professional athletes, acrobats that we've used Evolve on, and the device is extremely powerful. You can really titrate it. And I don't know any patient that can tolerate the max settings. So there's no concern over whether the device is powerful enough. You really have to titrate it to patient comfort. So essentially by electrically stimulating the muscle, we are triggering the muscle to contract many more times and much stronger than could be voluntarily achieved. And there is also a lipolytic or fat reduction effect adjacent to this contracting muscle. And the theory behind this is that release of free fatty acids is triggering cell death. Now there's a lot of marketing language that can confuse what electrical muscle stimulation is. And basically there's a concept of high FEM, which is high frequency electrical muscle stimulation. Essentially, this is a made up marketing term. Electrical muscle stimulation is electrical muscle stimulation because when, many of us know that muscle fibers work through electrical stimulation. So we have a nerve and it releases acetylcholine, which stimulates these myofibers and motor neurons. So essentially, the electrical current is what is stimulating the muscle fibers, and they can fire at different times to allow for a sustainable contraction. So we know that this is an MRI evaluation of electromagnetic therapy. We know that with these treatments, we get some fat reduction. We certainly get a muscle hypertrophy, and these are different patients. And very importantly in the United States, and I'm sure in the Philippines as well, when patients have babies, their rectus muscle separates. And this is a big problem because until recently, we've only had surgical solutions for these patients. And frankly, thinner patients have a harder time with this because every time they eat, they look bloated and they look pregnant. So this EMS is actually extremely valuable in recovery after pregnancy, recovery of the rectus muscle. So there is synergy in the EMS device where we're able to reduce fat, stimulate muscle in a synergistic fashion. Because previous body contouring devices have only really focused on one of these components. So either the devices have focused on fat or they've focused on muscle, but they've never focused on both of them together. So this is a demonstration of different studies not done by us that talk about circumferential reduction of different devices. And you can get fat reduction. The question is, and here you can see EMS on the bottom. EMS produces some fat reduction, about 4.3 centimeters on average. And then radiofrequency also produces fat reduction, as well as skin tightening. So together, we get a synergistic effect. So these are, when we were doing the studies for Evolve, I think and I'm happy to send some of the preliminary data, and actually I'm even happy to send the studies pre-publication. But when we were doing the studies, we really sat down and we said, we need to figure out if this technology works. And we need to show it as objectively as possible. Because if you look at many of the other device studies, to be honest, they're disappointing because they use very subjective measuring tools. Many times it's just a satisfaction scale, which is very subjective. The photography, if you look at many of the other studies, the photography has different lighting. The MRIs sometimes are different cuts, so different levels. So when we were looking at this, we decided to take an approach where we want to know if this works. And we want to know how well it works. So we have actually two camera systems. One of them is made by Quantificare, which is a French company that can measure volume very sensitively. It's a research grade camera. So for example, if you took one syringe, 1 cc of filler, and put it in a patient's right cheek and took a before and after, it will show you that there's an extra cc of filler in that right cheek. And we have another camera by Canfeld, which does a similar thing. So this is an example of one of the patients from our trial after their third treatment. And you can see the volume reduction of about almost 800 cc's in the abdomen. And I mean, frankly, to me, I don't like to typically compare non-invasive technology with surgery, but 800 cc's is a near liposuction change. That's just what it is. And the patients really sense that, and they're very satisfied with that because they fit differently in clothing. Their waist circumference is improved. Here's another example of a patient that lost, and we treated two different areas here, 500 cc's anteriorly and 350 cc's posteriorly in the flank area. Another example, 300 cc reduction and improvement in the abdominal contour. And here are more examples. Now, we know that radiofrequency heat injury, and this is an old study from 1994 on human fat cells, and it basically showed that heat injury exactly at these temperatures that we're treating, so we're applying a deep heat of 43 to 44 degrees Celsius for up to an hour. They identified in biopsies that there was significant amount of apoptosis in fat cells. About 10% of fat cells were dying related to the heat. And I like to pull up other studies because they, they're unbiased and they just show what the science is. So the other thing is EMS, in addition, has a significant impact on fat. So this is a study done on post-EMS animal model, which showed a significant increase in apoptotic nuclei of fat, with also increase in pro-apoptotic markers, showing that fat is undergoing an increased metabolic reaction, and it's believed that the free fatty acids released from the EMS is causing significant fat reduction around that area. So in combination with radiofrequency, we're getting a synergistic effect as well as skin tightening. This also showed that the amount of fat reduction is the same across different BMIs, so it wasn't specific to thin patients or heavy patients. The idea is that the stress of the endoplasmic reticulum of the mitochondria may be the mechanism of this apoptotic acceleration. So you can see here before treatment, this is the free fatty acid, the blue is free fatty acid. After the treatment, the free fatty acids increase significantly, and even after 8 hours, they remain significant, so demonstrating fat breakdown compared to controls, which are in orange. You can also look at pH levels. So we actually looked at this to demonstrate, the significance of the muscle stimulation as well as fat reduction. So you can see significant reduction in the pH, which is consistent with muscle stimulation and lactic acidosis after the treatments. Now, if you looked, we looked at professional athletes, we looked at rehab centers to understand how to optimize the muscle contraction and heat that's being delivered by this technology. And if you look at athletes, it's very clear, and if you look at rehabilitation, it's very clear that muscle contraction and recovery is optimized by heat. And this is a concept called heat acclimation. So heat benefits muscle mass. Training in heat allows for a more efficient contraction, allows you to do a more intense exercise with an improved recovery. So this is the device. This is the tight applicator. I wanted to show you how it can be applied in many different body areas. It's very customizable. It can be placed on arms. It can be placed on abdomen, on thighs. Here you can see this is a safety button, which really allows us to feel very comfortable with leaving a patient in a room. We know that if there's any kind of concern, they can press the button and it just pauses the treatment. And frankly, we haven't really had that be an issue at all. And there are 8 applicators, so this is the tight component. You can place it anywhere on the patient's body. So radiofrequency and EMS together have a significant additive effect in terms of fat reduction and muscle stimulation as well as skin tightening. So in conclusion, we have all pieces of the pizza pie, and patients are really finding a significant amount of value in this device to reduce fat and tighten skin as well as stimulate muscle. So I'm happy to take any questions at this point if there's any questions that you guys would like to address.
Doctor?
Yeah, I'm Dr. Garcia. Yeah.
Doc, dito po. We have a question from Dr. Garcia.
Sure.
Dito
He is
Gabra.
here with us.
Yeah, good morning. You have a nice presentation. However, my question is, it seems that you combine all existing products that we have also have, like you combine RF, muscle stimulations. These are already existing equipments that's already proven their value. Now maybe this equipment will be nice, will be optimal for standalone. If you have a clinic and you're all alone, you will just have all-in-one thing. This might suit you. However, for Marie France, like our company, as a big company, we have individual equipment. What good would this equipment offer to us? If we already have our own, like we have Tesla, we have our own tripolar, or we have even the advanced model, then what good will this machine in compared to the all other existing machines?
That's a great question. It's a great question, and we get asked that question a lot because oftentimes we have a practice that already invested in electrical muscle stimulation or other or a cool sculpting device, and so they want to know, what does this add? What is the benefit? Why would you invest in another platform? So there's a couple answers to that. Number one, the radio frequency here is very tightly temperature controlled and allows for volumetric heating at a deep level. So if you took a thermal image, and we've done this actually, if you took a thermal image after a treatment using our radio frequency, our Evolve hands-free radio frequency device, and compared it to any hands-free radio frequency device I'm aware of, the volumetric heating stays in the tissue for over an hour. So it's a bipolar volumetric heating at a deep level, at a very consistent temperature. So the device reaches temperature within about a minute, and it keeps that temperature consistent throughout the treatment. That's the first thing. Second thing is, now I agree with you, electrical muscle stimulation, in my opinion, is is patients value it, they like it, but in terms of the aesthetic result, it's probably secondary in terms of importance. I think where this technology shines is skin tightening and fat reduction. I think muscle stimulation is a significant value add from a business standpoint and from a patient value standpoint. But from an aesthetic perspective, at least in the American population, most patients value most fat reduction with skin tightening. And I don't know any other device that accomplishes that as well in a hands-free manner. Essentially an automated device. I'm unfamiliar. I mean, to me, in the United States, this is the only device that works in such an automated fashion that combines these technologies in this fashion.
A few more questions. That's a good answer. Yeah, I agree with you. That's the machine. The only difference between machine and our machines is this is hands-free. And then the next
Well,
question is,
I'll tell
how
you also,
often?
you know, so,
Yeah, go
sorry,
ahead.
just to add to that, you know, if you have, I mean, you know, if you guys have many practices, you'll understand the business and all that stuff better than, you know, better than anyone. But having a hands-free device also is a value add. You know, in the United States, having an employee, especially during COVID, but just in general, having an employee perform a treatment, first of all, because we have devices like that too. I have the predecessor radio
Yeah,
frequency
actually,
devices manually.
I agree with you with regards to the hands-free. Is an advantage in the present situation, and it also help in our manpower. But next
But
question.
also,
Yeah,
I
go
also
ahead.
want to add the efficacy of the treatment is it's much more predictable when the machine is doing it.
Yes.
Because when you're physically, I'll tell you, I mean, I have many examples. I have one esthetician who is excellent, and she does the treatment thoroughly and stays at a consistent temperature, and the results are different than when someone else does it who's a little more lazy, moves it too quickly. There's an art. So there's a lot of user dependent results when you're doing it by hand. That's one thing. Second thing is actually what I've found is when we put a patient in the room with this technology, we have a TV screen in the room, and it's playing fillers, it's playing other things that we do. You know, I would say 50-60% of the time that patient because they're sitting there for 45 minutes, they're captive audience, and they don't want to be sold things. They don't want someone coming in the room and trying to sell them more. But if you leave them in the room with this marketing material playing, I would bet that by the time they leave, they're buying something else. So there's a lot of downstream kind of downstream benefits that I've noticed.
Yeah, I agree. My next question is, how often do you treat the patient in a week's time? How many
Yeah,
treatments
so that's a great question. So for us, we do it every 2 weeks, and we're typically doing 4 or 5 sessions.
4 to 5 sessions. Every 2 weeks, 4 to 5
Yeah.
sessions. Oh.
I don't think there's any problem with spacing it out
How
more.
about the duration of the treatment per session?
Depends. So for skin tightening, it's usually about 45 minutes. Same thing with muscle contraction. Fat reduction, there's a fat reduction component of this, which is about 15-20 minutes. So assume about an hour.
An hour, yeah. And then we also have this, we have certain clients coming from the province. They usually stay here for a week. Since you said that you have a limited number of treatments, how many treatments can you do in a week?
In 1
For
week?
patient coming, yeah, we have clients coming from the different part of the Philippines, and they just stay here for a week. Can we do more than what you suggested?
You know, to be honest with you, I don't think that there's any problem with that. I think part of the reason we do it every 2 weeks is just logistically. I think that's just in the United States, people don't typically, you know, we don't have people traveling in. So the logistics allow us every 2 weeks is for us a good cadence. I think from a biologic standpoint, there's no problem doing it day after day if they're only there for 1 week.
Okay.
You know, and on the flip side, I don't think there's anything wrong with having the patients wait longer either.
That's all. Yeah, that's all my question.
Thank you, Dr. Garcia. Any more questions? Dr. Torres, hi. No more questions. Okay, since there are no more questions from Marie France, we will proceed with the demo, Doctor.
Okay, great. Thank you all.
Thank you.
Any question ka daw, ma'am? You have a question? You have a question?
Sure, I think there is a question. I see that there's a somebody.
Ito, ma'am. Paasi. Yes, please go ahead, Paasi. We cannot unmute. Wait.
Has to unmute.
You can type your question if you prefer.
Hi, we're from the marketing group of the Marie France. Our question is, I've read that this is FDA cleared, right? May we
Correct.
know the specific FDA approval that it was able to secure? That way, from our point of view, from our materials, we can be able to include it if in the event that we get this machine.
Sure. I don't want to misspeak, so maybe I'll leave it to the InMode folks to tell you specifically. I don't want to give you misinformation because I'm not off the top of my head exactly sure exactly how it's cleared in the United States. I can tell you that we are from a marketing standpoint. I'd actually love to share with you my social media and show you how we market this technology.
Okay, that would be helpful.
Because marketing, of course, is a very important component of these technologies. So I just want to show you exactly how we market this. So let me share my screen with you once more.
All right.
Can you see this?
Yes. Yeah, I'm seeing it.
Okay, so let me start it again here. So this is our social media. We have, InMode is a big part of why we have, a fair number of following. But let me show you Evolve here. So the devices are very attractive in terms of how they appear. Here you can see the application. Here you can see the each panel has a heat sensor. How it's customizable to different parts of the body. And how it does three different things, three different modules: tightening skin, muscle toning, and trimming fat. That's the muscle stimulation component. So there's 4 applicators there, and they stimulate the muscle. We've had a tremendous amount of demand for this. And marketing it is very easy because everybody's desiring non-invasive body contouring. And the other thing I'd like to mention about this is that, one of the things we did, and I don't know, maybe in the Philippines it's different, but we went to an exercise, we have a Pure Barre. I don't know if you're familiar with Pure Barre, but essentially yoga, like a yoga class.
Okay.
And that's really the ideal demographic here. So what we did was we sponsored a free yoga class. We had about 100 people come. So we did it in a large, because with yoga, it's very easy. They just bring their own mats and you could do it in any room. And we did a demonstration of this technology. And what we found is that is the precise group of patients that want to do these treatments. And we probably booked about 40 to, I think it was 45 treatments in that one session, because all of those patients have expendable income. They care about how they look. It's really that 30, 40, 50-year-old age group. And I think, you know, from a marketing standpoint, that was one of the most powerful things we were able to accomplish, is directly going to that group of people who go to workout classes and showing them the technology firsthand. And they love it, and they continue to come back.
Okay. Thank you for sharing that with us. I have another question, because most of our clientele would have a BMI of more than 30. I know this, we can still use this machine, but for a better appreciation of somebody, for example, who has a BMI of 33 or 34, how can we make this attractive to them, given that we have different platforms already? Because if it's radio frequency and EMS, like what Dr. Garcia has said, we have different platforms. And normally, if it has radio frequency or tightening, a lot of people would think, oh, it's almost the same as, for example, Venus Legacy or other platforms that we have. How do we make it more, you know, I know it's about 22% of fat reduction, if I'm not mistaken. I've read on it. How else can we make the benefits more tangible to that type of to that market segment, just so they have a better, you know, a better picture? Because sometimes even if we say in cold sculpting it's about 22.4%, it doesn't really register well. How do you do it in your marketing?
Great question. So let me talk to you a little bit more about all the three different applications, because I didn't quite show you each one individually. But so I think the strongest thing, so I agree with you 100%. In a higher BMI patient population, it's a little bit different. You have to market to them. You have to show them significant results, because they're not expecting, they feel like it's going to be a waste of money for them. So the way we've managed that simply is we show them the quantificare images with the volume reduction as a number.
Okay.
It's an objective number. So there's a 800 cc reduction. That's like a liposuction amount of reduction. Let me share my screen with you. I want to tell you a little bit more about fat reduction, because I didn't really touch on it that much, and I'm glad you brought that up. So, you know, the key thing is I agree with you. We're treating all different types of patients, and I think this is very important, because if you have a generally heavier patient population, you're going to need the synergistic effect of muscle stimulation. In order for them to feel value, you're going to need to give them muscle stimulation, skin tightening, and fat reduction in one fashion. So this is the trim handpiece, and I didn't really go over this that much, but it's actually a very significant component of your patient population, and ours for that matter. So what this particular, and this is a closer up view of this handpiece, what this handpiece is going to do is it vacuums the soft tissue into this chamber. And then what you get is a bipolar radio frequency that causes what's called electroporation. Electroporation is a method of basically breaking holes into the fat cells, damaging the fat cells beyond repair. So it vacuums your fat in, and then you get a radio frequency effect of electroporation, killing fat cells. And there's also some heat generation, which also tightens skin. So that's, and here you can see what heat does to adipose tissue. So you can see many of these cells lack a nuclei, so they're actually increasing the metabolic rate, causing a controlled thermal injury, which is killing fat cells. And the vacuum effect also improves lymphatic drainage and improves the penetration of radio frequency energy. So we published a paper about a year ago about the applications of radio frequency, and there are devices that add vacuum effect to improve the penetration of radio frequency. And you know, this is what I was talking about previously. So you can see here the heat profile post-treatment. So this is called the FLIR camera. This is a near infrared thermal camera. And what it does is it shows you what the temperature is at the skin surface. And I'm willing to bet you that if you took any other radio frequency device and did this an hour after treatment, the skin is going to be cold. And with this technology, we actually see significant heat, volumetric bulk heating. It's the difference between flash heating something and slow cooking it. It's almost like slow cook. And we have all these images. InMode has all these images. These are assets that you can use for marketing. I like to use science in marketing. Show patients. This is where the applicator was. Here is the heat effect. This is the amount of volume reduction you can expect. This is a patient's arm here. You can really see how the heat has really consistently heated the arm. So this is the other applicator, just to show you in more higher resolution here. This is the tight component. So you have bipolar radio frequency energy that moves from the central electrode to these outer electrodes. And now there's thermometer in between. So really InMode shines by not only delivery of deep radio frequency energy, but control. Because this device almost has artificial intelligence. It's consistently measuring temperature. So that allows for a very consistent heating. And as opposed to other devices that are manually done, it's not just the difference between hands-free and manual. Those are not equal. Because hands-free, it's artificial intelligence. It's the latest technology that's actually delivering better results because the computer is better at it than we are as clinicians. That's just the reality. And here you can see how the device is applied and how customizable it is. That's another big difference. No other device allows you, that I know of, to put this on your abdomen and thighs and treat at the same time. If you did that with any other device, you would either have to do one area at a time, which would take more time, or you'd have to have two devices with two different people doing it. And here's just a video showing how the treatment works. So here you can see on the left, this is the amount of time of treatment. This is the power. This is our cutoff temperature, so it's maxed out. So you can see every electrode is color coordinated. And basically it gets to target temperature within about a minute, and then it just stays there. So bipolar radio frequency, the energy is moving from the central electrode to the outer electrodes and maintaining the temperature. And this is a biopsy, and I show this to patients. This is a biopsy of a skin envelope. And what you can see is increased collagen thickening and concentration and reorganization of elastin levels. So there's, today patients want natural treatments that are not injected and are not implants. So this is a very good solution to that, because you can increase the thickness of collagen, reorganize their existing elastin in a very natural fashion. So I hope that answers your question. From a marketing standpoint, it's very easy to show patients kind of what this accomplishes from a scientific level.
I just have one more question, because you mentioned a while ago that your suggested treatment protocol is every 2 weeks, about 5 treatments. Am I correct?
Yeah, that's how we're doing it. So we're doing it every 2 weeks, 4 to 5 treatments.
Based on your experience in your clinic, if somebody who has higher than 30 BMI, a woman probably, if she's undergone the 5 sessions, what can she hope to achieve? Like, what's the maximum and what's the least based from your practice?
Well, there's a lot of factors. I think it's a great question. So in terms of combination of treatments, so when I look at a patient, let's take a look at 3 different types of patients. If you have a heavy patient, BMI 30, not very muscular, basically what they need is fat reduction and skin contraction. So those are the 2 applicators we use. We use the tight and we use the trim. And you can add muscle stimulation as well, but those are the 2 things. Now, normally what I tell patients is that, and they understand this, I would say, listen, this is not an immediate result. Radio frequency is going to take 4 to 6 weeks to see a result. And, I even think, depending on, getting one of these cameras that shows volume reduction is very powerful, because I take pictures of the patients before and I take a picture after, and consistently they will see anywhere from a 400 to 800 cc reduction. And if you do it objectively like that, nobody can, it's a very objective result. And I will say, as far as patient satisfaction goes, frankly, it's extremely high, especially when you're using 2 modalities. The likelihood of having a non-responder, in my experience, is rather low, because this technology is very powerful. Now, let's say you do have a patient that comes back and says, you know what, I expected more of a result. You know, we all have these patients, no matter what. Even if you knock it out of the park, there's going to be somebody that says, I wish I had more. They want, you know, fat is a very subjective thing. We could always use less fat.
Yeah.
Now, the beauty of this device for me, from my perspective, is that because there's no disposable cost and because it doesn't really cost me anything to do another treatment, I'm amenable to giving them another treatment, either at a discounted rate or on me, because they feel significant value because they didn't pay an extra $1,000 or $1,200 for that treatment. So you can even take the non-responder and very quickly turn them into a very happy patient by just offering them one more treatment. And it's not so easy to do that with Cool Sculpting or another device that has a significant disposable cost, because that's costing you money. And if you do that to everybody, you're going to go out of business.
Yeah, and my last question is, I'm just thinking, given the mechanisms that you've explained, is this good for people with stretch marks? Have you seen a before and after, a good before and after of somebody who's tried it? For somebody who has given birth and has really extreme stretch marks?
That's a great question. So what I would say is, you know, extreme stretch marks are basically a scar on the underside of the skin surface. What it will do, and a lot of people ask, cellulite and stretch marks. Cellulite I've seen improve significantly. Stretch marks, if they're very severe stretch marks, they will improve somewhat, but I wouldn't necessarily apply it to a patient that has severe stretch marks. I don't think there's any non-invasive.
Yeah, none yet. I'm hoping this would do it.
Yeah, that's the reality. But I think some skin tightening will give the illusion of an, you know, typically patients don't necessarily know what looks better. They just want to look better. Do you know what I mean?
Yeah.
Like they don't know. It's like if you take your car to the shop, they don't care if it was repainted, if it was polished. It just has to come out looking better. And I think if you reduce fat, tighten skin, no matter what, they're going to be happy with that. And one other thing I wanted to mention, which I didn't really touch on, as far as sequence of treatments, we typically, so if we're going to do an electrical muscle stimulation, we typically like to preheat the muscle before because we get a better muscle stimulation. So typically what we'll do is, and patients really understand it, they understand like hot yoga. Patients go exercise in hot rooms. So they're very amenable to this concept of first applying radio frequency heat that's bulk heating the tissue and then performing an electrical muscle stimulation. So that's typically our sequence.
So that's like tenderizing the meat.
I have a question, doctor. I just wanted to ask if the microstimulation, would it be advisable for us to ask the patient for us to be able to set it in a higher, in a stronger setting? Does it follow that a stronger setting of stimulation plus the RF would be more, come out with more effective, or it doesn't?
Yes, that's a great question. So the device goes up to a power of 50. It's an arbitrary number, a power of 50. I can tell you, professional athletes, some of the most athletic patients I have typically cannot tolerate higher than 32, 33. So basically what we do, and different patients are different. Some patients are more sensitive than others. So we start at 20 and I, just titrate it number by number until the patient is comfortable but feels it. And you can really see the muscle stimulation. And they're sore the next day. It's not a light treatment. They feel the muscle that's contracted. It's not a feel-good treatment. They feel that it was a real medical grade muscle stimulation. It's almost like doing 500 sit-ups. They feel sore afterwards the next day, which I think is desirable. You want people to feel like they got their money's worth and they got a very strong muscle effect.
Okay, thank you.
Dr. Dayan, can you hear me?
Yes.
This is Dr. Torres. I have several questions. I'm sorry if we're extending your time there in Nevada.
No, not at all. I like talking about this. We're good.
Okay. First of all, congrats on the pizza pie. I will now eat differently every time I see one. Regarding the electroporation by bipolar RF that kills fat cells in Evolve, is this exclusive Evolve or is it generic for all RF as long as the threshold is reached regarding the heat?
No, Great question. It's specific to evolve. So the waves are
Okay.
high voltage in a certain frequency. And as a matter of fact, in our study, what we did, which was actually very unique. So the three kind of most objective, I'll tell you how we designed this study is extremely objective. And one of those things that we did was we got electron microscopy images of the fat cells. We took biopsies on all our patients and we put it through an electron microscope. And what you see in the electron microscope is holes in the fat cells, and you see the free fatty acids actually exiting the fat cell membrane. So it's a very clear, and electroporation, by the way, is heavily used in many different industries. So for example, in the food industry, when they want to kill bacterial cells in containers, they go through electroporation. So it's not necessarily, the overall electroporation technique is widely used in many different industries, but as far as I know, in the aesthetic world, and it may be an intellectual property thing, InMode is the only technology that's electroporating cells using high voltage waves. And you know, Dr. Mishka Kreindel, or Michael Kreindel, who is the chief technical officer, you know, he's been engineering this for many years and has really perfected it to the point that it's not specific just to radio frequency, it's specific to evolve in terms of the frequency of the waves and the high voltage nature. And it's not painful, but it does certainly put holes in the fat cell membrane.
So I just want to clarify regarding the exclusivity of that process with Evolve. There are certain energy-based devices that they would always say that there's lipolysis happening, for example, in ultrasound, not the ultra shape, but the lower power, but slightly higher frequency. They also say that there's also lipolysis. But
Right.
in their case, it's not electroporation. It's more of the cell membrane being literally imploding. Is that correct? The
Great.
difference?
So thermal injury in general will cause some lipolysis. Like that
Okay.
study I showed in the initial PowerPoint, if you get to 42, 43 degrees Celsius,
Yeah,
they've
the
shown
earlier,
you will
yeah.
see 10% at a adipocyte death. However, the Evolve also adds electroporation, which
Okay.
additively is damaging fat cells in a different way.
And it's only in bipolar RF.
Bipolar RF, correct.
Okay. In connection with the free fatty acid release, you showed earlier that you determined it. It's local, you determined it locally, right? With a needle cannula. It's not systemic by serum.
It's systemic.
Oh, okay. The free fatty acid in general.
It's systemic.
Okay.
So for
It's
example,
systemic.
it's basically a surrogate marker for fat breakdown, or you
Okay,
know.
yeah, I get it.
So essentially, what we measured was lactic acid, pH, and then free fatty acid as a result of the treatment.
Okay. You also showed the Arrhenius equation earlier regarding temperature versus time. Is there a specific threshold? It would seem that based on that equation, any temperature, even lower by 37 or just 38, as long as you do it longer, it would appear that you could reach the same net energy. However, there's a threshold. Is there a specific threshold that should be reached?
Yeah, the threshold is basically 42, 43 degrees Celsius, in that ballpark.
Okay, so it's better to treat 42 to 43 longer rather than to treat 47, 48 shorter, based on your analysis earlier.
Well, I would say,
I think with
it
regard to
depends.
comfort.
Yeah, it depends. So what I would say is this. So it's a great question. The way I look at it is, it's potentially equivalent.
Okay.
At those differences. The way I look at it is, I'm comparing it, for example, so the body type device is like our minimally invasive device. It's like we do it with liposuction. That device is, you know, there's a wider range. So that's like 68 degrees Celsius for 3 minutes, 4 minutes, something like that. Now, if you compared it to the body type, yeah, it's a much higher differential. And frankly, there's other devices that are not InMode devices, monopolar devices, that reach 83, 84 degrees Celsius. And those are minimally invasive devices. Now, the problem with when you get to high temperatures is it's like driving a car, like a sports car. If you're going too fast, you may get to where you want to go to, but if you make a wrong turn, you're going to
Or
crash.
dangerous,
It's
yeah.
going to be a problem.
Yeah.
So,
Okay.
I look at it almost like when you're cooking food. Food is always best cooked at a consistent,
Yeah.
lower cooking for a longer period of time. It's kind of a similar analogy here.
Okay. Regarding the suction with regards to Evolve, the suction is during the treatment itself, it doesn't fluctuate, right? It's just there. The purpose is to increase the surface area, well, actually the volume that could be treated if you lift it, so that the current between the bipolar, the electrodes would be hitting more.
Correct.
Rather than going deeper, you're making it shallower because you suctioned it. There's no lymphatic drainage there, right?
Great question. So we actually did a study. So when I present our data on radio frequency, there's always a plastic surgeon that will ask, what happens to lymphatics and what happens to perfusion?
Okay.
And what we showed, and actually I'll try to pull it up for you to show you, we actually published on this in the Journal of Plastic and Reconstructive Surgery. And what we showed, and actually interestingly, this has been shown in lymphedema, where there's lymphatic obstruction. Actually, heat is very interesting because it's actually it triggers a proliferative cascade, and it actually produces neoangiogenesis and neolymphangiogenesis. And I'm going to show that to you here with our Morpheus device because it's a great point. I like.
I wasn't aware of that. I was only aware of neovascularization. I didn't realize that lymphatics could also
I'll tell
be
you why.
generated. Yeah.
I'll tell you why, because it increases VEGF, vascular endothelial growth
Okay,
factor.
yeah, yes.
And VEGF is a key player in not only
In
vascular.
formation of the new lymph. Yeah.
So exactly right. So you look at your skin, what are the components? We have subdermal vascular plexus and lymphatic vessels. So this is an example. This is bipolar radiofrequency and looking at perfusion. And this is, I don't know if you're familiar, this is an indocyanine green camera. This is the most sensitive perfusion assessment tool available in the world as far as I'm aware. So this is a near infrared dye that we inject, and it attaches. So this is a device that we can use to measure perfusion and measure lymphatics in different ways. So it attaches to the red blood cells, and you can really see in very high resolution how perfusion works. So everything in white is well perfused. And I'm happy to send you the data on this. We've actually shown, not just our group, numerous other groups have shown increase in VEGF, which has been shown to be associated with lymphangiosis. So actually, as a plastic surgeon, I use this technology post-surgery in lieu of lymphatic massage. So there's many applications here. So I say, listen, after I do a liposuction case, and you can target patients that have been treated by other plastic surgeons in your area. This is a way to stimulate lymphatic reorganization. And here, and moved it to the, excuse me, this is our microneedling device, which uses bipolar radiofrequency. And what we did was we injected this indocyanine green subdermally. And what it does is it maps out lymphatics. And what you can see is this microneedling device actually migrates the dye. And if you look closely, you can see the lymphatic channels are maintained. And when you do this treatment in series, it basically shows increased lymphatic formation. And another point I will make here, because I'm glad you bring this up, there's actually many off-label uses of this technology, and we're learning them more and more as we go. So we have patients that have, patients that get fillers. Sometimes they get chronic swelling related to these fillers. And when that happens, it's a problem. I don't know if you guys do a lot of filler injections there?
There was one already who had a Pfizer vaccine abroad. That was a Filipina who had allergy with the PEG of the filler. You'll be allergen.
Right. So yeah, great point. So we're doing a study actually looking at filler swelling. And filler swelling is actually far beyond just the COVID issue. It's a common issue. But long story short, I'm going to show you this briefly because I think it's relevant. Fillers are very common, and filler complications are actually very common, chronic swelling from fillers. Radiofrequency, from my perspective, is one of the few things that will improve chronic filler swelling, and I believe it's because of the lymphangiogenesis.
Yeah.
So there's a lot of, radiofrequency is a great technology because it can be applied to all patients, regardless of Fitzpatrick type, and it works on everybody. It's non-specific energy, but it works very well. So I'm just going to show you this briefly. These are some of my mentors. Dr. Dan Baker, you may have heard of. He's one of the world's most famous facelift surgeons. And he has the benefit of operating on people from all over the world at very high socioeconomic levels. And this is an example, this is an extreme example of a patient that had overfilled face. More money, more problems. And I don't want to get too far off track, but basically we've shown through the lymphatic mapping that there's lymphatic obstruction with filler very commonly, more commonly than many people realize. And this is an example of a young patient that had filler injected in the cheek, and this indocyanine green dye doesn't wash out. And the only way, and we're actually writing this up actively, we actually have a meeting about it in April. I'll show you the meeting website. But radiofrequency is a key component to how we treat these patients because it improves lymphatic drainage. And there's a lot here to talk about, but and I'm happy to send it to you. But basically, because of the way the fillers are cross-linked, they cause lymphatic obstruction. And this is what I'm talking about, patients that have this chronic swelling.
Okay.
And it happens all over the face. So this is more evoke territory, but radiofrequency in general is a great solution to this problem.
Okay, thanks.
Yeah.
The VEF is not specific for just blood vessels. It's the same VEF also for lymphogenesis.
Yes, vascular endothelial growth factors is for both.
Okay. Regarding the lymphatic drainage, normal method supposedly should be better because you're draining it towards the lymphatic flow, towards the lymph nodes, as
You mean
compared
lymphatic-
if it was just stable.
You mean lymphatic massage specifically?
Yeah, the massage.
Yeah,
the
absolutely.
manual.
No, yeah,
The advantage of Evolve is supposedly it's hands-free. You
Well,
don't
so-
have to do the massage per se.
Great question. So the truth is, lymphatic massage is hard to replace because it's a very mechanical pushing of lymphatic fluid toward the lymph node basins. And it's a very specific pressure and a very specific direction. However, for example, there's a very well-known body contouring plastic surgeon named Alfredo Hoyos in Bogota, Colombia. He is one of the premier high-definition liposuction surgeons in the world. And he uses radiofrequency in addition to lymphatic massage post-surgery to heat the tissue, contract it, stimulate lymphatic organization. What I'm trying to suggest is, from a business standpoint, you can apply this to post-surgical patients. You can apply this to non-surgical patients. There are many different ways. And frankly, I actually, unfortunately, as a surgeon, sometimes when I do big operations, I have areas of skin laxity afterwards. It happens. And so this is, for me, actually a great solution post-surgically as well to deal with patients that may have a little laxity or a little area of fat collection that I want to improve post-surgical as well.
My last question, probably Evolve would be, InMode would answer it better, although you could answer it also, Dr. Dayan. So if we got the machine, and it's already here in the Philippines, if we wanted to add a protocol that after the treatment, we could do the manual lymphatic massage, it's okay. They won't be against it.
I think it's a great idea, personally.
Okay. Okay.
Actually,
Thanks, that's all.
it's very interesting you bring this up. So there's a group in Beverly Hills, California here that called me yesterday. And they're planning, InMode doesn't know this yet, but they're planning on a major center focused on Evolve. And what they're actually doing is exactly what you said. They're
Changing, just adding.
they're branding a package. So the package is going to be their package, which includes Evolve, which includes an element of nutrition, Evolve, and then probably some type of physical therapy.
Energy-based device with
Yes.
probably lymphatic
And
section.
actually, they're putting their center very smartly next to a very high-end gym. because it's going to be a very synergistic relationship.
Yeah. Thank you, Erez.
My pleasure. Thank you. Thank you.
You haven't accepted my invitation in LinkedIn.
Sorry, invitation to what?
Okay.
I'm sorry.
I
think
tried
lost
to connect with you in LinkedIn last night in preparation for this.
Oh, I'm sorry.
meeting.
I will.
Okay,
I get
thanks,
honestly,
Erez.
I get
Okay.
so many. I don't even look at it. I will.
Okay,
Absolutely.
sorry. I was one of them. Yeah.
No, I'm gonna add you right now.
Okay.
I would like to add something. This is Rory from InMode. I would like to emphasize this platform is modular. It has three components: the trim for fat reduction, the tight for tightening, and the tone for muscle toning. And you can take the full configuration for some centers, or maybe some centers where you feel you don't need all of them. You can take two or one component. So, or you can start with one and two components and add. Of course, it's more cost effective to take the full configuration. And the advantage is that in the same room, in the same seating, the clinician can decide for a specific patient and for their preference, which applications to use. As Dr. Dayan said, usually if we do toning, we'll do tight first, we will heat it. And for some patients that are more higher BMI, we will do usually the trim for fat reduction and the tight.
Thanks, Darren. Basically, it's better to have all the tools so that whatever problem comes in.
Yes, and if you want to add your LPG after post treatment, of course you can do that.
Oh, yes.
Yeah, I
Thanks,
agree.
Darren.
I think having all, and one thing that I think we assume sometimes is when a device has too many components or has many components that none of them are best in class. Do you know what I mean? Like you may assume that the EMS device that's a standalone EMS device is superior for some reason. We've actually put these devices side by side. Yeah, we put these side by side, and frankly, each one of these individual components, I believe, is best in class. And we've done comparative studies that are coming out. And I think when I judge aesthetic technology, the best assessment I can make are the following. Number one, was there objective data used? And in this technology, I'm more than happy to send you all our data. We have objective images that show you, like I showed you, the fat reduction in there's no lighting effect. That's the camera. The camera gives you the number. We have histology, which is extremely objective. And we have blood work that shows free fatty acid and lactic acid. So to me, when a company or when a product you're very confident in what that product can do, you seek objective data. And I can tell you, when you look at other technologies, as I'm sure you guys are well aware, when the data is subjective, when you're looking at it, and by the way, one more thing, we took our before and afters. Many times you'll have other plastic surgeons vote on the before and after, how much of an improvement, 1 to 10. We took our before and afters and we put it through an Amazon program called Amazon MTurk, where basically you get thousands of votes on the percent improvement from complete strangers who are objective. And
like
they
photofill.
measure it 1 to 10, because what do I care what a plastic surgeon thinks who may work for the company that they're doing the study for anyway? So we plug it into Amazon, we got thousands of votes, and we got a genuine, what is the improvement? Because I think InMode is smart in regards to longevity. It's not about selling you a device, today and then not tomorrow. It's about having a relationship long term. And I've been looking at this technology and using it for probably the last 5-6 years, and I love it because of the ROI that it's produced for us as a practice. It's worthwhile. It's like anything else. Advertising is good if you get a good ROI. Devices are good if patients feel value. So I think the objectivity of the data, but I really want to emphasize that each one of these three components, in my opinion, as a standalone, is best in class, and as a combination is very synergistic in terms of how it works and how you can customize it. It's all about customization.
Thanks.
Dr. Dayan, I have a question again. I'm Dr. Garcia. One of our main problems here is for older individuals with regards to skin tightening. And based on what you recommended is 5 treatments, you can see results, especially for the, I don't have any question regarding the muscle, the toning for the muscle, but it's more of a skin tightening issue. So my question is for older individuals, do you have a different protocol aside from you expect same results in 5 treatments? That's my
Great
question.
questions. Of course, candidate selection is important.
Mhm.
And from a non-invasive technology, you can't apply it to, your 68-year-old patient that has just a ton of loose skin. There's definitely an element
Yeah.
of patient selection. So really, I think where this technology shines is going to be the treatment gap group. This is what we're talking about is 30, 40, 50, maybe a 60-year-old that, early 60s that hasn't had kids or is very fit. So it's very patient dependent. Now, what I'll say in the Asian population's darker skinned patients tend to have thicker dermis and tend to respond to radiofrequency better. It works best for us in Asians and African Americans for the most part. Your typical Caucasian patient, on average, has less good skin elasticity, less thick dermis. Now, this is an important point because, the customization of it. So what I would say is this: if the main issue is skin laxity, you have to treat maximally with tight, and then probably include some element of trim because there's also a heat effect. So those would be my 2 priorities. Typically, when I look at a patient, I find 2 priorities. So if it's a very heavy patient, my priority is going to be fat reduction. And if they have skin laxity, it's going to be skin tightening. If it's a thin patient, my priority is typically going to be skin tightening and muscle stimulation. So I kind of look at the patient and I think to myself, where are they going to feel maximal bang for the buck? If it's a patient that can't see their rectus muscle anyway, the muscle stimulation falls into a secondary priority. So it's a matter of looking at the patient, prioritizing them. But we have a lot of patients that are active and thin, but they have skin laxity. And to my knowledge, this is the best non-invasive method of addressing that patient population. The other thing I want to mention is patients are actually very reasonable because they know that a non-invasive technology is not surgery. This is not in place of a tummy tuck. This is not in place of an arm lift at all. And I'll tell them, look, this is an arm lift. This is 100% improvement. We may experience a 20 to 30% improvement in you in this circumstance. But you know what? That's actually a great thing because the patient, when you do a big operation, when you have big downtime, big costs, they're expecting a big result. And I think, to patients that do non-invasive technologies, when they see a 30, 40% improvement, they're thrilled. And the expectations are reasonable. So it almost self-selects for very reasonable patients.
Yeah, thank you.
Okay, so thank you so much for generously sharing your time and expertise with us, Dr. Erez. If there are no more
Thank you.
questions, we will now
I'm going to
proceed
leave my
to.
email. Thank you. I'm going to leave my email here. Please feel free to, if you have any follow-up questions, it's in the chat here. Oh, sorry. Let me do it to everyone. Please feel free. I'm happy to answer any questions. And here's my number as well. If you want to send me WhatsApp messages, that works. So I'm more than happy to share with you. Sorry, it's 001. I'm very happy to share with you our data. I'm very confident in the objectivity of it. I had the opportunity to work with a number of different companies. As a young plastic surgeon, I like to align with companies that I think have a lot of integrity and quality. And InMode for me is one of those companies. So I'm very happy to share with you any of the objective data we have.
Thank you so much,
Thank you
Doctor.
so much. Thank you. Have a great day.
Thank you. Have a great day too.